In this lesson, I am going to teach you about the cups themselves. Okay, so we've gone through the PowerPoint about how cupping originated and how we use it. So I'm going to start to introduce the cups now, and then we're going to look at each individual area. So the cups themselves, as we've said in the PowerPoint, you've got lots of different styles of cups. We're going to be teaching the plastic suction cups, okay? So as you can see, there's lots of different sizes. And depending on the area in which you're going to be using the cupping therapy technique depends on what size you're going to use. So, for example, if I'm going to be working on Paul's erector spinae area, I'm going to want a larger cup as opposed to a smaller one, because I'm going to get obviously a larger surface area here. However, saying that, it does depend on what you're trying to achieve. If there's a particular point in which is quite tense, aggravated, hypertonic, then you may choose to go for a smaller one to have more of an impact on that small area. So it really depends on what you're trying to achieve, and that's what it's going to come down to all the time. What is it that you're trying to achieve with your technique? Okay, so with the cups, you'll notice that some of them, if I take that one again, will have these little inserters inside as opposed to some of the others that don't. These inserters do actually come out, so you can use the cup with or without. It's a method of trigger pointing with the cupping therapy. So on the very end is a dome. So as you suck the soft tissue up into the cup, you will then press against the inserter inside, and that acts as a trigger point, just as you would use with your thumb, but you can do it with the cup itself. Okay, so when it comes to using the cups, what I'll always say is you place the cup where you want to use it. Okay, and then you're going to take your gun, your suction gun, and you're simply going to do one pull, okay, which then sucks the soft tissues up into the cup. Now, that's just one. I'll always say start with one full pull on the trigger, and then you can always add more if you feel necessary. So there's half and there's full. So you can put quite a bit of tension on the cups and on the skin itself. But it really depends on, again, how tight, sensitive the area is, how much your patient is prone to bruising, because if they're prone to bruising, you might not want to put as much suction on there. And to release the cup, you simply release the valve at the top, which will take all the air, will allow the air back in and obviously release the soft tissue. Okay, but always start with one full pull first, and then build from there. Okay, and that is how you apply the cups, how the cups work, and now we're going to move on to each area and how to use the cups in each area.